Representative Thompson lays out the committee substitute to House Bill 2032. Mr. Turner, would you tell us what House Bill 2032 is and the difference between the bill and the substitute?
Yes, I will. Thank you, Madam Chair, members of the committee. And I appreciate this opportunity to lay out the committee substitute, House Bill 2032. So the committee substitute is identical except for the addition of one word, dentists. So we added the word dentists in the list of the types of people who could be appointed to the Health Literacy Advisory Committee. So, Madam Chair and members, this bill addresses the topic of health literacy. Now, what is health literacy? Well, it's generally defined as the degree to which people have the capacity to obtain, process, and understand basic health information needed to make appropriate health decisions. So examples of that would be the ability to properly follow prescription instructions, for instance, or understanding the significance of things like blood sugar levels and cholesterol levels, the relationship between lifestyle factors like diet and exercise and good health outcomes, and also the ability to properly interpret health plan options and make decisions about health insurance. So those are just a few examples. Now, low levels of health literacy are a problem in our state, in our nation, and I could cite studies on that, but I'll defer to some of the witnesses behind me to talk a little bit about that. The bottom line, poor health literacy leads to poor health outcomes, and it greatly increases our health care costs. So what this bill would do is require our current statewide health coordinating council, the 17-member body that's governed by the Department of State Health Services, to appoint an advisory committee that would specifically make recommendations about increasing health literacy. And that committee would in turn be tasked with developing a long-range plan for increasing health literacy in our state. The reasons for this are relatively straightforward. First, like I just said, if we improve health literacy, we get better health outcomes, and we also save on health care costs. And second, we currently in Texas do not have a body that is devoted to understanding and addressing this issue. And there's a recognition of the need for one in the public health community. And in fact, in the statewide health coordinating council's latest update to our state health plan, they made 4 recommendations, and the first of those recommendations was for the legislature to create a committee or an entity to develop a plan in this area. So they were the ones really asking for this, and that's what this bill does. And the approach of this bill is the one recommended in that update to the state health plan, that is to form a committee with academics and physicians and nurses, health plans, dentists, consumer groups, and others, and they will look at the best way to help improve our level of knowledge of health-related topics in our population, and they'll recommend implementation of practices and programs in that area. I'll mention, by the way, this bill is substantively the same as House Bill 3682, which was filed last session by Representative Arevalo and was heard in this committee and passed out of this committee unanimously. We have some witnesses here who can speak briefly but knowledgeably on this topic. And at this time, Madam Chair, I will yield to them, and I'll reserve the opportunity to close.
Are there any questions of Representative Turner? The chair calls Angela Morris, Aurelia Basadua, Carolyn Burgesson, and Bergeron, and Teresa Wagner. Would each of you state your name, who you're representing, your position on the bill, and then proceed with your testimony. And when you are all finished, then we'll ask you questions.
Thank you, Chairwoman Thompson and members of the committee. My name is Angela Morris. I am the Community Relations Director for Parkland Health and Hospital System. Since Parkland is a government entity, I am testifying neutral on the bill.
Thank you.
I would like to share Parkland's perspective on House Bill 2032 and how not only it will improve the care of Parkland patients, but as well as the Texans across this state. Understanding complex medical conditions is always difficult for patients and can be even more challenging for the elderly, those with language barriers, or those with limited education. Low health literacy can limit a patient's decision-making capability and lead to poor health outcomes. We believe that becoming an active participant in one's health care improves one's overall health. At Parkland, we recognize the importance of increasing health literacy by not only ensuring our healthcare materials are culturally and linguistically appropriate, but by educating our community through various outreach events. Parkland looks for opportunities to engage Dallas County residents at health fairs, faith-based meetings, back-to-school drives, and through numerous other avenues. While many health systems, such as Parkland, have taken a proactive approach to improve the health literacy of their patients, a more coordinated approach is needed to improve health literacy across Texas. The statewide advisory council established in House Bill 2032 will increase awareness, provide strategies to better address this problem, and seek ways to improve the overall health of all Texans. I wish to thank Representative Turner for authoring House Bill 2032 and the committee for the consideration of this bill. And if I may add a personal note, Chairwoman Thompson, I too am a proud member of Alpha Kappa Alpha Sorority Incorporated, so it is an honor to be before you this evening.
Thank you.
Thank you.
Good evening. My name is Dr. Teresa Wagner. I am testifying neutral on this bill because I work for a state entity, which is UNT Health Science Center. I am also a senior fellow at Safer Care Texas, which is a state-funded patient safety institute, which I don't know if a lot of people know about exists. But I wanted to start by saying that we've talked a lot about health literacy today, but you guys may not have realized that. But almost every topic we talked about, maternal mortality, opioids, Alzheimer's, all of these things we talked about people understanding health information and being able to make decisions. Even the conversation we just had about biologics, the man that was sitting up here was talking to you guys in a language that you couldn't understand because he wasn't speaking. Well, he couldn't understand because he wasn't speaking in a health literate manner. And this is the things that people are coming up against in their day-to-day lives. So health literacy work actually has the potential to reduce the impact and cost of these literacy issues. In the handout that I provided to you, there's a lot of statistics about the impact and the prevalence of low health literacy. However, when I testified in the last session, you guys asked me, are there any more recent statistics? And the reason that there's not is we don't have the capacity in Texas to produce those. House Bill 2032 would give us the capacity to produce those new statistics. And I just wanted to call to your attention the example of MedStar Mobile Healthcare Services, who has started doing health literacy services. And in doing so, they have several different services that they provide. And one is a readmission reduction service. And they follow patients who have 100% risk of being readmitted. And they've decreased that to only a 48% readmission. They also have a nurse triage program, and we've talked about this a little bit today about people not understanding whether they're going to an urgent care or ER. Well, this nurse that answers the phone talks to people and works them through that so they know where to go, so they don't go to that higher level of care if they don't need it. They also have they also help people improve their perceived health, which gives them improved self-efficacy so that they don't get readmitted because they feel like, oh yes, I can take care of my own health at home. They also address high utilizers, people who are high users of the ER and other medical services, and they've saved over $16 million with that program alone. So as I said, there's more stats I could give you, but I would say that this bill would allow us to update those statistics for Texas and develop a plan for Texas. And so those are all of the facts that I have to share with you today.
Good evening. My name is Oralia Basaldua, and I am testifying as a private citizen, so I am representing myself, and I am in favor of House Bill 2032. I am a clinical professor at the Long School of Medicine in San Antonio, and I co-founded the San Antonio Health Literacy Initiative about 15 years ago. And specifically, I am a clinical pharmacist, and I see patients as a physician extender in a family practice clinic. And I've been doing this for a long time, so I have about 22 years worth of examples of how low health literacy can lead to poor health outcomes and higher costs. And so I'd like to give you some examples, and I have provided 2 booklets for you that have additional scenarios. In the first case, the patient did not read and was not given instructions on how to use a suppository. He ended up inserting the suppository without removing the foil that it was wrapped in. So he later complained of anal pain, and this resulted in the need for a colonoscopy. Now, I don't know how much the suppository costs, but when I looked up the average cost of a colonoscopy, it was about $3,000. So this could have been easily avoided with simple instructions on how to use that suppository. The second case is a 10-year-old girl with asthma that was given an inhaler by her doctor. He told mom that it was for her chest and it would help her daughter breathe better. The child did not get better and ended up in the emergency room with an asthma attack. After some questioning, they discovered that mom had been spraying her daughter's chest with this inhaler instead of using it by mouth appropriately. So again, an avoidable situation with an ER visit that can cost up to $3,000. Now, probably one of the saddest things that I see in my practice is patients having a stroke or needing dialysis because they did not take their blood pressure medicines on a regular basis. And when we ask them why not, they say, well, I felt fine. But no one explains to them that high blood pressure is nicknamed the silent killer. And so strokes have financial consequences, as you may know, but the personal disability is often very devastating, all because we did not take the time to explain to the patients the seriousness of high blood pressure management. Now, I picked medication scenarios because that's what I do every day. But low health literacy is cross-cutting, and it affects all areas of healthcare, as we just heard, and as I've been hearing since 11 o'clock this morning. And it does not only affect people that do not know how to read, but it can affect well-educated people like yourselves and myself, because medical jargon is different than legal jargon. And I see some heads nodding. So as a pharmacotherapy specialist, I had the honor of serving on the Medicaid Pharmacy and Therapeutics Committee a few years ago. So I was on the other side listening to drug companies asking us to include their drugs on our preferred list. What we forget sometimes is that a $5 drug can end up costing $3,000 or more if it is not used correctly, like the unwrapped suppository that led to a colonoscopy, or the ER visit that resulted from the incorrect use of an asthma inhaler. So in closing, 15 years ago, the Institute of Medicine recognized low health literacy as a national epidemic, and we took that seriously in San Antonio. We have made a dent with a number of initiatives, but this is a much bigger problem that needs to be addressed at the state level as proposed by House Bill 2032. And I thank you for your support.
Good evening. My name is Dr. Caroline Bergeron. I represent the Bexar County Community Health Collaborative, and I am in favor of this bill. Today I want to talk to you about healthy aging because it's my research interest. I've done a lot of research projects on it. And so I've done research, for example, on older adults with diabetes, with different chronic conditions, on Alzheimer's, on ageism, on falls, people breaking hips, on veterans, minority populations are examples. And in every research project, I've always included health literacy as a component. And that's because health literacy disproportionately affects older adults. In fact, older adults have the lowest levels of health literacy across all age groups. And this may be due to, for example, a decline in cognition, where it takes more time to process information, to recall information. The same for examples of physical aging, hearing impairment, vision loss, which also cause those types of issues. And these challenges may also contribute to people being embarrassed or ashamed of asking questions in a medical encounter, asking for help to understand a consent form. So why is this important? Because one, we're all aging. but two, also because the older adult population is the fastest growing age group, as you know, and older adults typically have more chronic conditions, which means that they have a greater need to navigate the healthcare system and need that information the most. And because of their lower health literacy skills, older patients have access to less preventative services, less chronic disease self-management programs, for example, which result in increased emergency department visits, increased hospitalizations, and higher medical costs, which is what we are talking about today. So according to the Texas Healthcare Spending Report, Texas spent $42.9 billion in 2015 on healthcare, and the primary reasons for those expenses were chronic diseases and the aging population. So exactly what it is we are talking about today. So I want to say that the health literacy is an issue we want to address now, and as my colleague Dr. Bazadua here said, the Health Collaborative is here to support the San Antonio Health Literacy Initiative that has been around for 15 years in San Antonio. And it's actually very similar to what is included in the bill, to have a steering committee and advisory council there with different components, different parties involved to support and address health literacy, to promote health literacy. Right now we are doing it across San Antonio, Bexar County, but we really need your help in support of this bill to extend that across the state and make this an important issue for Texas. Thank you.
Chairman Frank.
Yeah, I really appreciate it. I think the goal of the bill is noble. I'm trying to figure out, because from an advisory committee, how do we get, because you've mentioned several issues, obviously, older person, I don't know that that's necessarily a literal, excuse me, literacy, they're losing cognitive function. And then you also mentioned some other things that, to me, in both the cases with the spray and the suppository, certainly the spray, there should have been an opportunity for the doctor, and the doctor should have communicated that literacy. That's where that should have happened. I'm trying to figure out how the advisory committee in Austin ends up having an impact on any of the patients that we're actually trying to help.
Sure. So by having an advisory committee, they could make a plan of how to promote. Oh, sorry. My name is Caroline, Dr. Caroline Bergeron. Sorry. They can make a plan of how to implement this across the state. For example, in the curriculum of medical students, to make sure that there's a component of their curriculum that focuses on health literacy, that talks about patient-provider communication, or to make more outreach events across the state for different consumers, for example, to learn more about health literacy, to become an advocate for themselves, to be able to ask those types of questions in those medical encounters.
Okay. And the only other comment, and really it's more of a comment than a question, is I guess when you look at the people that are included, there's 9 different groups. 8 of them are essentially the money side, the people who receive money in health care, and there's 1 that's the consumer. And I would suggest that's a real off. But
I'd like to comment, if that's okay. My name is Dr. Teresa Wagner, and I just wanted to add that we are already changing the way that medical students are being educated. We are starting to include health literacy in their education. I'm on a health science center campus, so we ensure that our students receive health literacy education, but I do think that is one of the keys. But I also think that we need to develop a culture of health literacy within our state, and the way that we do that is by changing the payment model, which has already been mandated. It's just taking a long time to swing that way, where you do the payment bundles and you lower the reimbursement for readmissions. So that incents the medical community to make sure that patients understand. We also need to, if physicians can't be given more time to spend with the patient, then they need to refer out, and they need to use that interdisciplinary care, which is another thing that we're teaching at our medical schools. So it's really, like I said, not just focusing on teach back or training patients, but it's developing this culture of health literacy throughout the state.
If I may add, Angela Morris, Parkland Health and Hospital System. I think the most important thing, just so for example, at Parkland, where we have in our electronical health record, where we have a library of patient health education that is provided to our patients at discharge. And that can be something as simple as how does one manage their diabetes, etc. Well, we have our clinical health education department is really utilized to vet a lot of this information and work with our healthcare professionals across our healthcare system to make sure that there's plain language that is used in the materials that we have for our patients, but also to ensure that the illustrations as well is also understandable. So I think this coordinated effort can help to leverage a lot of the work that organizations and my colleagues here across the state to really take more of a standardized approach. And just to really give you an example of volume, why this is so critical, when you look at Parkland's outpatient volume, so we're taking the emergency room, our urgent care clinic, our primary care clinics in the community, women's health centers as well, and specialty care. When you looked at our numbers in fiscal year 2018, so just a year approach, that patient volume was roughly 1.2 million visits. So it is important that we are making sure that every person that comes into our facility or any of our facilities, that they have a certain understanding so we can continue to make sure they have a certain quality of life.
And I think this is Dr. Teresa Wagner. There's a lot of research being done across our state, and like you mentioned, it's just bringing all of that together, and that's what this committee would be able to do, is take the time to actually bring all of those together and make a plan for the state.
Any further questions, members? Thank you very much. Thank you. Is there anyone else wishing to testify for, on, or against House Bill 2032? The testimony is closed on House Bill 2032, and the chair recognizes Representative Turner for a brief closure.
Thank you, Madam Chair, and thank you for your attention today, members of the committee. And I'll just take 1 second just to address Chairman Frank's question, because I actually had the same question as well in this process too. What is an advisory committee going to do to sort of affect that communication that occurs between the patient and the physician or other healthcare provider? And one thing that I did learn in that process is the intent is hopefully to help influence whether medical instruction or continuing medical education in a way that emphasizes the importance of this issue and helps to instruct in best practices for it. And I thought that was one way in which this committee hopefully can formulate good recommendations that can be promulgated through that educational system, possibly even recommendations for schools and public awareness campaigns, other things that hopefully will influence the way those things are communicated. And I also agree with your comment, Chairman, about the importance of making sure that patients, consumer groups are represented here. And the way it's written, it's not intended to be exclusive to the examples given here, but just to make sure that those relevant groups, academic community, consumer groups, et cetera, physicians are represented and included. With that, Madam Chair, unless there are any further questions, I appreciate your attention and be grateful for your favorable consideration. And I close.
Members, the chair is going to move to withdraw the committee substitute to House Bill 2032 and leave House Bill 2032 pending. Are there any questions? Chair hears any objections. Chair hears none. The bill is left pending. The chair now lays out House Bill 1668. Members, and by Allison, this is a bill that merely updates. It updates